Hi, my name is Alexis, and today I'm going to show you how to do trach suction and care. I've already checked the patient's medical records. I have done hand hygiene, and now we're going to walk into the patient's room. Knock, knock, knock. Can I come in? Hi, Mrs. Jones. So today I'm going to be cleaning your trach. If you feel uncomfortable or anything, just put your hand up, and that will identify that I need to stop and take a break. So I have already gathered all my equipment, and now I'm going to check Mrs. Jones' ID band. Is your date of birth January 1st, 99? Okay, thank you. And your name is Mrs. Jones. Okay. And now I am going to put my mask on. And I will also be putting on gloves. And these are just clean gloves. And so the first thing that I'm going to do is check the suction that is usually mounted to the wall. I'm going to make sure that that is on, and I'm going to make sure that it is at the appropriate level. And so it is on, so I'm going to set that next to Mrs. Jones. And now I don't need these clean gloves anymore, so I can remove them. And I do have a waste bin next to me. Okay. And so next, I'm going to need my suction kit, which I'm going to open. And I have made sure that my sterile area is dry and clean. So the first thing that I'm going to do is carefully grab this box and open it up. I don't want to reach over my sterile. And I'm going to pour some saline solution in that. And now I'm going to grab the sterile gloves and put those on. I'm going to move Mrs. Jones. I'm going to be careful not to touch the inside, and to make sure that I stay on the outer 2 inches. Okay. And then I'm going to carefully pinch one of the gloves, being careful not to touch the outside. And if my gloves were too small, I would be able to grab a separate pair. Okay, now that I have my gloves on, I can discard of my sterile paper. And now that my hands are sterile, I can grab my suction. And since I am left-handed, I will be wrapping it up in my left hand. And I am going to take this end and put it into my suction. And I'm going to check it by doing this. And so now that I have my suction plugged in, I'm going to take the end of my suction and dip it into the saline solution and put it through the disposable cannula, and I'm going to be putting it in the measured length. And now this hand is going to become my clean hand. And I'm going to do circular motions as I come out. And then I'm going to do it again. Same thing about 3 times. And now that that is done, I could give a few breaths if needed. But now that I am done with this, I'm going to remove the cannula and the dressing and dispose of all this. Making sure not to touch the exposed area. And I would disconnect the suction tube before taking off everything. So now I'm going to perform hand hygiene, and I can now discard of all this. And I can also discard of my box. So now we're going to move on to the tray cleaning, which I will be needing this along with my new clothes cannula. So I'm going to move Mrs. Jones over so you guys can see my tray. And so I'm going to open my tray and there is a spot where I can pour my solution. And since I already had it open, I would lip it off and then continue to pour. And now I'm going to carefully grab my sterile gloves and open those. Move this out of the way. And being careful not to touch the outer, only to touch the outer 1 inch. Okay. Then I'm going to grab my glove by pinching it and carefully putting it on my glove, making sure not to touch the sterile side. Now I'm going to carefully not touch this because it fell. Grab my glove and put it on without touching the inside since it's sterile. Now I can fix my gloves and I can carefully remove this. And now that I have sterile gloves on, I can touch anything in my tray. And I'm going to take my drape and I'm going to put that down to extend my sterile field. And now that I have that, I can open my new cannula and place that on my sterile drape. And I'm going to take the cotton swabs that are in my sterile tray and put those in the saline solution. And now I can add, let me move Mrs. Jones in view so you can see without touching anything. And now I can take this hand and take my new cannula and put it on. And now this is my dirty hand, and I can take a swab, dip it in the solution, and carefully wipe just a section and discard of that. Take another one that's been soaking in the solution and do another section and discard that. And then we're going to do the top section, discard of that. And then last one, making sure to get the other part. So now that it is clean, I'm going to take a dry piece of gauze and carefully dry the area. Now I'm going to do the bottom half, discard, and then take another piece and do the top. And now I can take my split gauze and put it around the trach, and then now I will replace the necktie. So what I would do, since I'm the only person, is I would wrap it around, I would put it around Mrs. Jones' neck and start with one side. I'd carefully remove that side while holding the tray in placement. I would loop it through and tie it off, and then I would do the same to the other side, making sure that I hold the trach in place. And so now that Mrs. Jones's trach is cleaned and taken care of, I can remove these gloves, discard of them. I will perform hand hygiene, and before I leave the room, I would listen for her lung sounds and make sure that she is comfortable and in a comfortable position, and everything is good for her. And that's it.